Yeah, today we're going to talk about unionization of the peer workforce and the benefits. Today we're going to talk, the purpose of our presentation is to share information about our labor organization and how it represents the values of peer support. Our goal is to have an open and engaging conversation with you, the audience, about your experiences with unions and to gather information that will help us better represent the workforce. We want to make sure everyone feels comfortable participating regardless of their background. We hope to encourage those who are interested to sign up with our organization for representation, subscribe to our newsletter, attend our meetings, or get involved in other ways such as joining our board or committees, developing cooperatives, or other organizational efforts. So as mentioned, our presenters, my name is Mitchell Sherman, and I'm a Wisconsin State Certified Peer Specialist and recent intentional peer support graduate. I'm also co-chair of the RITF, a Recovery Implementation Task Force, which is an advisory council to Wisconsin's Department of Health and Human Services. My union background is as an electrician, an engineer, and a food commercial worker. And it's my honor to present to you Laura Lemke, RAP Facilitator, recipient of the Cindy Willie Peer Pathways 2020 Award, and they are a founding member of the National Peer Support Warmline Council. In their union background, Laurel served as a union counselor while a member of AFSCME during her career at Western State Hospital in Washington State. She is now involved in the RPEC Retiree Committee Union, where she has made a demonstrated impact on legislative advocacy and success in challenging and changing policy. So real quickly, we're just showing you this slide of the table of contents, and we'll be highlighting these subjects as we go over the countless benefits of unionizing. So our very own labor organization. Is there a union for peers? And I'm here to tell you today, yes. Since November of 2022, we have been in development and continue to expand into the future. We are currently representing peers across the nation as our membership grows. During this presentation, we want to invite you to share your stories and experiences at any time. Just raise your hand, or as Laurel said, she's monitoring the chat, so just put your questions in there. So grassroots, where it all began, apparently our editing team has a little edit there, the equal sign's a little off, but organizing the peer support workforce. So I had sat in virtual spaces across the nation, spaces like the National Peer Support Warmline Council, some SANSA-funded trainings, NADIC, NAMI, the Peer Center of Excellence, and some others. And in each of them, I kept hearing the same thing. Where is support that we provide for us peers? Where is the union for peers? Where are the livable wages? Where are the employers for peer roles, not for paraclinicians or role drift? So I started looking, and I didn't really see many opportunities for myself or for my colleagues, and I asked questions and didn't get many answers. So with my background and my various lived experiences, I got to work bringing some of the peers together so that we could create a space for our very self. So what is a union? I just like how the term is kind of viewed today, which is why I label us a label organization. The word union carries a lot of controversy, which has become a political interest term instead of a workers' right and advocacy effort. But a union is a specific type of labor organization. Our peer labor organization is all about supporting each other and helping everyone recover in a positive way of their choosing. We make sure to use language that helps people feel good, and we always stand against any kind of unfairness. When we talk to other people or make agreements, we always remember what our peer supporters need and want. Here are some common myths about unions, but I want to share with you my first union job. So before I started in this union, I was a worker for a fork truck driver as a labor yard, in a lumber yard in a house manufacturing space. I had previously applied for electrical apprenticeship, but was informed that I had to start working as an entry-level construction worker to earn a sponsorship and recommendations. Seeing this as my foot in the door of a great career to build my skills, and I took it. But however, 2 weeks later, I was fired for cause. Although my employer was a union shop, there were many issues. Not clear, young adult workers were improperly supervised. They chanted mantras like permanent marker erases permanent marker because someone had placed sexual graffiti onto their tools. Unsafe conditions existed around every corner and under the breath of each order from supervisors. Homophobic or intolerant and hateful speech was a daily trauma experienced by myself and coworkers. Ultimately, I was new to the trade and needed to learn. I was not a grunt willing to power through unsafe conditions. I asked questions on how to perform a new task properly and really wasn't given much guidance. So my experience was My experience with my union representative was more focused on helping me change work placements than rectifying the ongoing conditions or issues at my site. Later on that termination for cause, it became an issue having that incorrect blemish on my union record. I felt that this was one of those spaces where unions forget their roots. It's in their members, not in their employers. Some other negative experiences people have had with unions or concerns include worries about leaders not being honest or clear in their communication, or about leaders misusing funds. Others may feel like they don't have a say in union decisions, or that leaders don't like to listen to their members' ideas. There may also be disagreements or tensions between union leaders and members, or resistance to new ideas or ways of doing things. These are important issues to consider when thinking about joining a union. It's important to find a union that prioritizes transparency, accountability, and member participation. So unions have consistently helped the workforce in these areas. I know I can share a few experiences where the unions have helped. So I had come back from surgery, needed some short-term accommodations while I'd healed. My employer refused, and a union mediator got involved and found me some work within my restrictions in another department. While without the assistance of the union, I would have had to choose between my health and my career. Laura, can you share any times that maybe the union has helped you in the past?
Well, I feel that there have been times that we were always working on unsafe work conditions. And one thing that we do awareness every year when there were difficulties of unsafe conditions and even deaths in the workplace. And this was working for a statewide union for public employees. But I think particularly, when there was a problem on the job and you were being sent in for a discussion or correction, having somebody with you, represented with you, which was very important and helpful.
Anybody else? What other benefits would you like to see? What has your personal experience been, or your thoughts to share? Anyone? If not, we can move on to the next slide. And
I can just say for me, I was particularly concerned about this because I saw, people who were corrected or ended up ending to leave, asking to leave jobs without there being negotiation. And that's why I can see the role for unions. Thank you, Mitchell.
yeah, thanks for sharing, Laura. We appreciate you having you here. So these are the 12 areas SAMHSA has identified in peer support. Unions in general already represent these values. One of the main goals of a union is to create a sense of community among workers and foster a spirit of shared experience where workers feel supported by their peers. This includes being non-judgmental and respecting each other's personal experiences and decisions. Unions also work to empower workers by giving them a voice in the workplace and advocating for their rights. This includes promoting personal responsibility, self-determination, and mutual respect. Unions also provide hope by fighting for better wages, benefits, and working conditions. Confidentiality is also important in union representation, as workers need to be able to trust that their personal information will be kept confidential. Unions work to build trust with their members by advocating for their needs and keeping their information private. Overall, unions represent the values of peer support by creating a community of workers who support each other, empower each other, and work together towards common goals. And this is just unions in general. This isn't even talking about a peer-specific union. So we wanted to ask everybody in the audience if they have any experiences of any of these values in their own workplaces, whether they're union or non, or share some of their own experiences and where they've had these values in place. And I'll share that prior to joining a union, revealing my background was concerned with employers. I would be in constant fear that my employer, whoever they were, would terminate me because of it. That people would talk about me and someone would hate me enough or judge me without even having met or spoken to me. I had this fear because I experienced it over and over again. If not from employers, then in other spaces, and other communities, or and my own home or my hometown, all those fears kept up in those places where people may have known me from my past or know about what happened. So I felt like this, despite my experience and capabilities, I was stuck in an entry-level, skillless, and unfulfilling poor work life. That I was just going to temp agencies or spaces where short-term employment was their goal, and getting benefits and things established really weren't. But the union created a barrier of confidentiality. By being a member, I was protected on so many levels. The union employers saw me as a capable member to fulfill a role and function. Instead of all my personal experiences, they were only aware of my professional ability. I was empowered. I had hope for my future that not only could I belong, but I could also be something more, and that I knew where to put effort into achieving that goal. How about you, Laurel? Anybody else? More than welcome to invite, raise your hand, put something into the chat.
Well, I just wanted to, and Richard had just put in chat that in California, there's a legal aid for workers. And I don't know if you're sharing that because that's where you're working, or you say that's another resource that, and he's also putting disability in work. He's putting some different, Richard's putting some different resources in there for us.
Awesome. Thanks for sharing those.
And we
Javi
have a
has their
hand
hand
up
up.
by Javi. Yeah.
Hello, good afternoon.
Hi.
I just had a quick question. Are unions allowed in nonprofits?
100%. So there actually is a union specifically for nonprofits. Not that you have to be with that union specifically, but there are nonprofit representation. I believe it's the NP nonprofits, employees, NPSEU. But yeah, nonprofits can definitely have a representation. The only spaces that you would normally have concern is in other unions and possibly state employees, where they have like laws pertaining to them not being able to. Usually your local National Labor Relations Board or whatever union you're discussing with would have more information on restrictions on being able to join their membership for sure.
Awesome, thank you.
Yeah, and I see Richard Gallo has a hand up as well.
Yeah,
If I
you
pronounced
just
your
sort of
name
answered my,
incorrectly, please
you did,
correct
you
me.
did. You sort of answered that question. If for those counties that have peer-run programs, they're county employees, so they can join the SEIU union. Question is, do they have the option of joining your union instead of the county SEIU at the county levels?
It would depend on the county and how it's set up and how that union's established. It could be a requirement of your employment that you're a part of that union, and then there could be a contract set up with them to say that if they don't supply enough employers, then maybe they have some right to work things, and that's some other step we'll get into later on about right to work. But that does sound like it depends. You can definitely be a member of another organization or a labor organization, and as well as a union is the kind of the aspect going on. It's with that clear distinction that we're an organization first and focusing on those labor efforts as opposed to those that union terminology.
So
Okay, thank you.
Richard, my experience was being part of AFSCME, so knowing how that union works. And when I talked to Mitchell, when he was part of an electrician union, it was, knowing it was quite different. Where I worked, we were required to be part of the union, and it might be, but there were some jobs in the state that weren't required to be part of the union. So it would be something that needed to be worked out. And so maybe addressing some different concerns, but it's a good question.
It is. Because in some states or in some counties, you're treated as a contractor. Some states you're treated as directly as a county worker, and then you fall under different parameters for how they have to treat you and for what you're capable of doing in some cases. But do we have any other questions, comments, any other shares? All right. Laurel, did you want to touch on something else here?
Just generally that I think, particularly, I think that one thing the union really does is help people with empowerment. And the fact is you're working with other people who have shared experience. So I think unions are really peers. And one thing we may talk about is that a union can be very different depending on who's in it, but hopefully you have good people, and it involves people stepping up and helping each other.
Yeah, not only who's in it, but how they're operated. There's
Right.
different approaches on If it's a top down where whoever is sitting at the head of the organization is the one that kind of makes all the decisions, or if it's a collective approach, which is what we are, which is where all the members have a voice and say, and it's the people at the top who are held to the responsibility of all the other members. So a really active participation by having more members engagement is crucial to having those unions operate. But as a peer-led labor organization, we strive to embody these values, the SAMHSA values, in all aspects of our work, from our collective bargaining representations to our meetings and cooperative developments. We understand that workers may face challenges in their personal and professional lives, and we work to provide a supportive community where they can share their experiences without judgment and receive support from their peers. We also prioritize personal responsibility and self-determination, recognizing that workers are the experts in their own lives and work. We empower workers to take an active role in the representation and in development of our organization. Additionally, we advocate for our members' rights and work to create a more just and equitable workplace for all. So let's talk wages. Union employees traditionally earn about 11% more than non-union spaces. In my experience, union jobs not only paid more, but I felt more secure in knowing that I would not be desperate for work and that I wouldn't feel cheated come raise time. The National Survey of Compensation among Peer Sports Specialists in 2016, the average wage reported was $15.42. Note, the workforce must be continuously reviewed and studied. I think we're still waiting for some more reviews and studies about the peer workforce in this regard. I'll say that there have been some, but there have been inclusive of clinicians and the entire community healthcare worker labor force. So it's everything from like volunteers all the way up to doctors even, or clinicians who are overseeing programs who are included in those studies. So it's not a real representation of the workforce. However, I'll note that I hear some organizations are conducting some, but as far as how inclusive or seclusive they're going to be with their survey, we're not really sure. As we know, wages vary depending on so many different things, and not just the Medicaid reimbursement rates, which I do have listed here that in 2019, they ranged from about $6 to $24 and averaging about $13 for their fee-for-service rate for 15 minutes. Some more potential benefits are a transparent pay scale that focuses on experience and education. Some benefits that the employers see from unionization are just a few, to name a few, are lower administrative expenses, increased productivity, lower employee turnover, improved workplace communication, and it promotes a better trained and supported workforce. So how do we get to livable wages or sustain them? With a clearly defined, transparent, and equitable pay scale that focuses on experience and education. A peer support union can offer specialized training, consultation, and advocacy services to employers, as well as assistance with grant applications and partnership building, ultimately promoting a stronger and more supportive workforce and better outcomes for those that we serve. So we touched on wages. Let's touch on dues briefly. Right to work is a term used to describe laws that prohibit unions from requiring employees to pay dues or fees as a condition of employment, which can weaken the financial and political power of unions. This is a map of all the right to work states with right to work laws, and those that don't. You'll notice that there's a commonality between like red and blue states over the past 4 years, pretty closely aligned with how this map goes. Fair share, though, means that dues are only paying for costs associated with collective bargaining and contract administration. They are not used for any ideological or political purposes. In our labor organization, we will create clear opt-in and out methods outside of dues if we support any ideological purposes. So as I became diagnosed with my disabling condition, I realized I would not be able to physically keep up with the demands of my electrical career. I spoke with the union about my options, as my current employer was already terminating me due to my limitations or reasonable accommodation needs. They expressed that I would be called when my name came up for the next job. They could not place me specifically in a role with less physical demands. In essence, they were not going to find me work unless my health improved. Yet they still wanted me to pay monthly dues and support them when they would not consider supporting me, much less consider where the income was supposed to come from to pay them for dues. So that's why I believe in being fair share from the start. When I was working, I paid working dues out of my paychecks directly. I still supported dues from some of the other efforts, but I was not aware I really had a choice in the matter. That's why in our organization, we will be clearly aware of the choices of any donations and what they're used for, because that's what they are, donations, not dues. It also helps us avoid those politically charged anti-union campaigns and allows us to stick to our grassroots. So a peer labor organization that operates across the country can join forces with local unions, cooperatives, and other groups to work together, share information, and speak up as a single voice for peer supporters all over. They can help make sure peer support is done in a consistent and quality way so that it is seen as a more professional and respected field. This helps everyone, the workers, their bosses, and the people who get peer support. It can make the workforce stronger and better at their jobs, which leads to better results for the clients and for the community. So I want to ask, what makes you a peer? Does anybody have an idea what makes you a peer? Is it your lived experience? Is it your state or some other form of certification? Is it the actual act of providing support? Anybody else have ideas? Throw them in the chat, raise your hand. I think what makes you a peer is the other person or people you're serving. If they don't see you as a peer, then from their perspective, you're not. Despite any similar experiences you share, your training, or anything else. I was in an AODA program where they had speakers come and meet with a large group of us. The first speaker had some lived experience with substance use and was able to speak with the audience, but it wasn't very engaging. The second had no lived experience. They tried using that qualifier of having been around secondhand marijuana smoke and feeling a little funny. They immediately lost the room's respect and attention. The group joked and laughed at them. The third speaker was a longtime recovery AA member, but they, unlike the rest, connected with the entire audience because of how we viewed them as a peer despite different paths to recovery or any other differences. They were not a trained peer, just a well-respected member of the community whom over the years had acquired skills. Even still, we were excited to have them continue coming and disappointed when they couldn't make it. We valued their time, their view, and their experiences, even if we didn't agree with their path to recovery. We felt that mutuality and connection from them and saw hope and recovery was possible. So comparing some state certification processes, as some of you may know, across the 50 states, they vastly so differently. But generally, the process goes, to be eligible in some states, you may be required to provide a mental health diagnosis or verified lived experience with a history of substance abuse and pass a caregiver background check to qualify for training or for employment. Then you take some sort of certification or training course to become a peer, and you may need additional on-the-job training or supervision hours before you can actually fully become certified. Finally, some states require continuing education beyond certification. These differences make state reciprocity or equity a challenge. And I mean that so that if you're in one state, let's say Wisconsin, and you go to Illinois, Michigan, bordering states, or California, it's not recognized as a means of bypassing the training education requirements or a way to have your certification recognized. You'd have to go through that state's entire process from start to finish in order to get certified. So understanding some problems peers face. I interviewed for a few different places. One was at a clinical place where they wanted me to note any document, or they wanted me to note and document not only my observations of their patients, but my opinions on them as well. They wanted me to do everything I could for their role in person so they could just manage medications. A clear case of peer drift and cooptation. Other roles I found paid little, if any, wages, if they even had any benefits. We're seeing some new jobs for decent wages come out, but either they have no benefits or they are operating under short-term grant funds, so they're not sustainable and securing gainful employment for yourself and thinking that, I'll have this job for the next 5 years. Well, their funding only lasts so long. These are just some of the problems we're facing in the field, some that we're aware of. For me, the biggest barrier is finding an employer that will meet my needs as a disabled peer with reasonable accommodation. How about you, Laurel?
Um, for me, it was, I also, had issues where I needed some support that I had to really argue for the reasonable accommodations.
Are there
And
some other problems that people have faced? Feel free to share. Sorry, I didn't mean to cut you off, Laura. I thought you were finished.
Yeah, and I'm trying to, I'm thinking more of I'm thinking again, in the peer role, I had one thing that happened too, is that they were changing insurance companies. And so it was really important to have input on the benefits that were happening.
Oh, definitely.
Right.
I know with my additional insurance needs, if they change providers and then all of a sudden something's not covered, now they want a $60 out of pocket to get that medication, or I have to challenge with my doctor to have them add it to a necessary medical thing to have it bypassed to get it included in my insurance plan.
And Tina just shared that there's no pathway for advancement. So
Right.
through the union could be supportive of that.
Definitely. I mean, they want you to, and that's seen in a lot of employers. They just want you in the role that they hire you for. They don't want to see you expand or grow or have, better job supports. They think that you're just happy to be where you're at, and they want to keep you complacent instead of provide you with those job opportunities and growth that you want. They have needs of, we need people to do this, sure, and you're happy to meet those needs for that pay, but where's your support? Where's your growth? Thank you
Well,
for
I think
naming
in
that,
this
Tina.
case, particularly for peers, it's a matter of there may be some advancement, but then you're no longer a peer, but different roles for peers. Karen just shared in chat, short-term contracts are funded for a limited period of time. And I just saw that. I saw a peer bridger position listed in Washington State, and that indicated that would end. That was 2 years. The most recent, the role I had in peer support was COVID related, so mine ended after 23 months. Yeah, so it's sort of like some of these peer roles, they're like trying them out versus investing in them long term.
I mean, that definitely can give you trepidation and whether or not you'll take the job even. If you're not even sure about me, I don't know if I'm sure about you.
Yeah. The first peer role we had in state government, if I had taken that, it would have actually been a decrease in pay. So I didn't apply for it. And so we've got another comment here from Karen. Karen is saying, for pilot projects, clinicians can find other jobs in other teams, but peer experience might not transfer to other vacancies.
Yeah, and that's totally valid. That's something that's we're fighting is, our lived experience is of value, but how about our work experience? If we're not being paid for having 4 years experience in our role, we're not having those increased in pay. We're not seeing that professionalism that we really should be equated to. I really think that as peers, we are the alternative to therapists and psychologists. So why are we not being treated as their equals? I'm not necessarily saying we should be prescribing medications. I don't want us doing that. I'm not saying that we should be giving anybody those types of things, but why aren't we be treating as that way? There's no reason that we have space that we could take up in every avenue of life. We can be in the legal department, the justice department. We can help that bridge between how many times have you, I was in the I interned with Justice Point. I don't know if any of you are familiar with them. They're in Wisconsin, maybe some other spaces, but they do some work with peers in that restorative place where if you get in trouble with the law, there's an avenue for you to get out of that being on your record. And it was a beautiful opportunity for peers to engage in. But how many times could you have used a peer to talk to your attorney or to even know how to talk to your attorney? And then to help bridge that gap of how to, facilitate speaking with the judge when you're going through the divergence program. Peers are just so valuable in these spaces that they can be, but they're just unfortunately not quite utilized there because we don't know how to utilize them there. There's no funding for them there. That's the biggest thing, funding. Where's the money for the services, for the studies, for the evidence-based practices, and for these things to grow? Where is it coming from? So I'll move on to some of our solutions. So we have some more ideas to help make things better for peer support workers. One of the things we can do is make sure that there are enough workers hired to get the job done. Often we see minimal peers hired in places where they are required, or they use dual role peers where they are primarily hired for the other job, but cover the facility's requirement for staffing. We can also make sure there are good health and wellness programs. We can also try to fix bigger problems like discrimination and unfair treatment. And finally, we can help peer support workers feel like they are part of a team that supports them all while working together to make things better for all. A labor organization of peer support workers can do all this and so much more. Some of the things we're doing now is actively representing peers in states with employers for collective bargaining with the National Labor Relations Board, developing a cooperative owned by local peers in rural and underserved communities, organizing events and trainings, connecting local peers and organizations together, and providing supports and resources to peers on a national level. So why a peer labor organization? That's interesting. There we go. So why a peer labor organization? Why peer support? It's important for us to form a union for peer support because we need to work together with other healthcare professionals to provide the best care for peers. We believe that everyone should be included, not just peers, because we want to build strong relationships with other workers in healthcare. This will help us improve the quality of care and outcomes for peers. When we work together with other healthcare professionals, we could show them how valuable peer support is, which can lead to more recognition and support for the field as a whole. Let's get on to our next topic, which is support for the supporters. Laurel's still here. They just had to shut their camera off just so everyone's aware. So is your employer supporting you? Anybody answer these questions, raise your hand, put them in the chat. What are they not doing you would like them to? What supports are you not seeing or experiencing employers that you would like to? What changes would you like to see made in the workplace or in the field? And then we do have another question of, if you had just one ask at the table of decision makers, what would it be? If they had to listen to you, if they had to do it, what would it be?
Tina is saying path for advancement. And
We hear you, Tina.
and Karen says she's heard of many peer supporter workers not getting regular supervision. So I don't know if you mean regular supervision, appropriate supervision, if you want to be any more detail by that.
I'll be happy to touch on that while they come up with some details. So career advancement and supervision, both in one package, right? So SAMHSA and some other organizations have definitely been in support, and as well as we are in support of supervision of peers by peers, not of supervision of peers by clinicians. There is states like in Wisconsin, where I live, where we are required to have mental health practitioners supervise us in that fee-for-service Medicaid reimbursement role. So I'm familiar with how that process works, but at the same time, we're working on ways to go around that. We have that benefit in Wisconsin that if we're under a grant or non-fee-for-service roles, you can provide peer support whomever you are. But we definitely want to support that advancement pathway of having embedded champions, mentors, and I mean peer mentors, peer embedded champions, and peer supervision. So your supervision hours, if you are required to have that whatever amount by a mental health practitioner in Wisconsin, it's so many hours. You need to have 1 hour of supervision for every 30 hours you provide of in-person support. So if you need that for your mental health provider, and I hear what you're saying about not getting enough supervision, then they're just providing you with that 1 hour for every 30 hour you provide. They should be providing you with another embedded champion, a leader, somebody who can actually provide you with your peer support supervision, someone who can guide you on a difficult or challenging call that you had, guide you through utilizing your employee resources or your employee assistance program, which we don't have and clearly need for ourselves and for the other supporters who are providing support out there. You know, our police and firefighters, our EMTs, they also need peer support and they need spaces to get that, and they don't have insurance or employee assistance programs providing them it, and they desperately need it, especially when we're talking about roles where if you reveal use or connection to it, you could be questioned and you could have your role taken away or put on suspension. Laurel, you got something to add there, I see.
Yeah, we've got some different comments coming in. And one thing is, so Karen was saying that regular supervision from lived experience practitioners would be ideal. But she said some people aren't getting any supervision. And that would be a real issue. Deborah says that her program was lacking. There wasn't any module on communication skills. And that's one of the things where Mitchell and I have, some differences where when I was part of the union, it was so many different, there were so many disciplines in it. It wasn't that the union did so much training, but when it was electricians, they did training in union. And Mitchell's vision is that when you have a peer support union, that the peer support union would be involved in trainings. Richard said, so that's that. And Richard is saying that peer supervision with peer supervisor with lived experience is critical for peers and the supportive of peers equally. And we getting comments for that. Also, Deborah's saying there's not support at all in Southern California, no standards for certification. And I am aware that I've had people from California wanting to have, I think your certification has changed. It started fairly recent. I'm not sure.
Yeah, I think
then
the
another one.
certification came out near the end of 2022, maybe somewhere in there. I knew they got like release for it and information for it and things, but I know California has been desperately hungry for more information on peer support and some services and things. And there's definitely a lot of national programs and a lot of national centers. Doors to Wellbeing, the Copeland Center. There's our own organization, Peer Support, the Peer Center of Excellence, NADIC, NAMI. SAMHSA, all of these are great national organizations that have connections with other spaces, maybe that in states where they run free trainings and that you can log into, get some additional supports, get some additional skills. All these things are available. And this is one of the things that we work for in our units, provide supports to as our members, is access and connection to all of these skill building and retention places.
Okay. So one of the things I'm saying is you're listing a number of resources there, and Deborah want to know how you could get the list of resources. So I don't know if you can put that on the information page.
I do.
Yeah.
Our final slide will have a QR code with resources. I can also add into the chat later on access to the slideshow, as well as so that you have access to the slides. It's not going to be what our presentation is, because that involves you guys for the whole audience of the presentation. But you have access to that, as well as access to our website, which will give you have links to those supportive resources, and we do list a lot of those organizations there.
And Richard is saying that peer certification is currently by counties and not state certification. I know that the Doors to Wellbeing or the Copeland Center, one or the other, is offering training in California. I was able to observe one of those trainings.
Awesome.
But
how was it?
It was excellent. And and partly, a lot of things, have been done because of COVID. We have people now who are in the state of Washington. It was done online for a week instead of in person. We've gone back to in person, and what the Copeland Center did is they did 1 week online, which is I was able to observe part of that, and then they were meeting and training. And I think those individuals, like you said, Richards, they may have been from one county, or but that's one of the things that's kind of hard, because there's a trade-off between having a national certification where everything's done, everybody does the same thing, and people having the empowerment of having it individualized.
Yeah, and SAMHSA came out with pretty good guidelines, and it's just going to be interesting to see what what folds in that. I know I've done some advocacy efforts in Washington as well as in Wisconsin, and we have other members that are doing advocacy in their own states and areas. So I don't know what exactly is going to happen from that. We would love to have some involvement in the shape of things to come, and to help be a support for those organizations, or at least put them in connection with the resources they're seeking. Did anybody else have any comments? Otherwise, we'll move on. I saw somebody was unmuted, but they're remuted, so I didn't know if they changed their comment. But by all means, just raise your hand at any time. We can backtrack a little bit or move forward. So what organizations can do: empower worker wellness first, show workers that they are valued, have policies ensure that appropriate care is accessible, develop supports specifically to needs, and create a culture of inclusion. These are just a few of the things organizations can do. So some final thoughts here. We view strikes as a last resort in negotiations or workplace safety. Unions work like a team where everyone gets a say. Members can help decide what the union does and what's most important to them. Some other protections: you can feel more secure about your job because the union will have rules to protect you from being fired for no good reason. If you feel like you're being treated unfairly, there will be ways for you to speak up and get the help. And some common questions we've had is like, will I make less money? And we will not make collective bargaining agreements with an employer resulting in lesser wages or benefits to our members. If it doesn't make sense for your bottom line, why would it make sense to us? And our goal is to serve you. So thank you so much for joining us today. I encourage you to visit our site, join our newsletter, and if desired, sign on for representation. If you want to get involved in other ways, you can apply to join our board or serve on committees, along with other opportunities as we begin developing cooperatives in your local and rural communities. We want to give a special thanks to Vanessa Williams of Elevate Recovery in Arizona, to put together the background for the slideshows of us. These slides are just for references, and as we said, the handouts will be provided to you for share and review. And then those of you who have been here in attendance, there's that QR code right there for that supportive resources. It takes you directly to that site that gets updated pretty regularly. And then we'd like to invite you all to spend the rest of this time here as a discussion, answering questions from the audience or chat. Raise your hand if you have something you want to share, whether it's about this or not, just something that we can touch on for the remainder of time that we have together.
So we have two comments that have come in, and one was Deborah said that California has an exam to certify, but her program focused theory, law, and history of the movement without practicum, with like probably the hands-on of doing it. And Karen says, this is wonderful. She says, there's a United Kingdom perspective on unionization, on lived experience workers, and that she has Mick wrote here, and then so she's got a resource here.
Awesome. I'd love to see that.
Yeah, so it's in the chat.
I know
Yeah.
I put on the website, there's a few international resources as well. I don't want to focus just on what we have here, because oftentimes in our work, we do come into contact with people who are across the seas. I work on Discord, which oftentimes has teens from the UK, Austria, you name it, really, to be honest, Canada. We get them from all over, and they're just reaching out for some supportive help, and they get it in a peer space from their fellows, from other teens or from professionals in that setting who are willing to provide it to them.
And just so you know, that was just posted on March 29th. So it's a recent post, fairly recent post. And we're excited that we are going to be presenting at Peer Apocalypse
In Oregon, yeah.
Yeah, and so Karen was asking if you have space on Discord. I know we have a space for Mitchell and I have been involved in warm liners. So there's a space for that. Do you have a specific space on warm liners for your peer source?
So my peer, that's one of the spaces I do some volunteer time, is in a server that has a life advice channel for anyone to just ask, request advice from the entire server. But we do have tags for persons who are willing to provide that advice so that they can get notified that somebody is there looking for that. And we put a nice disclaimer up there to let people know that this is, public and whatnot. And that's not necessarily, but it's private in the sense that they have that indemnity of using whatever name they choose and everything else. But as far as a specific link to like our organization on Discord, we don't have that established yet. It's one of the things we're working on building, is getting like a national peer support warm line integrated with other technology, and getting other organizations and stakeholders involved in that. I mean, as you've seen that there's Hear Me Now, or there's peer what appears now, is it what it's called? There's several apps that you see advertised for even therapy from clinicians and doctors happening. And that's something that we've been looking into for quite some time, is how we can get involved in that space and make more advocacy there so that we can connect local peers like yourself with people in need immediately, as well as for later on for additional supports that they want. So that you're getting the service you need now, but then you can also establish a meeting with your local peer, getting additional advocacy and resources that local peer would have connections to.
So just so you know, Karen, thank you for answering the question about Discord. And I basically, I've gotten to know Mitchell and knew he was doing this work. And for me, I really felt my experience was, I was in a huge organization with unions, and it was very rare, if for somebody to be let go from the employer, there had to be a lot of work done and verification for it to happen. And then I had experience where I saw somebody who didn't have a lot of experience as a peer, a fairly new peer. Mistakes happened, and the way it was resolved is they left the organization. So I really feel that there is a role for having support from others when there are difficulties with the job and representation. One thing about to be figured out is that when we had union representatives, they were really volunteers doing the work to do that. So there is training that's involved in it. So this is all something that's to be developed more. And my question was, and then says, will peers ever be considered first responders like other public health officials? And that's kind of an interesting question, because we have like where we are, we have actually our first responders in Washington State, some of them, like the firemen that are being trained as peers for each other. So that's a good question.
Yeah.
And Tina, for the certificate of attendance, I believe that John wants you to put your information, your email in the chat, and then he will send you a certificate. And Richard has a question.
So I wanted to address Javi real quick about that. Will peers ever be considered first responders? I mean, there's eCPR, so that emotional CPR that we can give. There's also, we can work in that crisis support line. If you're familiar with 988, you could be a crisis responder as a peer. I don't necessarily classify that a peer position because of how they operate, because they do that recording and that reporting and all those all those invasive forms of support. That's not something we want, but I would love to see them create a peer space within 988 that's not recorded, that is an alternative to that allows us to be crisis reducing or crisis aversion or crisis alternative, so that we can also connect them with that crisis of, let's say someone calls and they took a lot of pills and they need a crisis unit to come out there and help them. We can provide them with that connection, but at the same time, we could be there to talk to them while they're waiting for the response to get there, so that avoidance of 911 can be present. Richard, go ahead, please.
And Deborah has
Yeah,
shared de-escalation. Go ahead,
I just
Richard.
wanted to respond to Javi's question, that peer workers can be part of the mobile crisis unit. It just depends how the job description is written. And normally with the mobile crisis unit, there's an EMT, a clinician, and then a peer, a person with lived experience. And I know currently there are several city, counties, and a university in California that are hiring peer lived experience worker to be part of the crisis unit. In the future, it's my understanding in California that we're going to end up having a 24-hour crisis mobile unit instead of having law enforcement dealing with the mental health community because of individuals getting killed by police officers. I'm a former healthcare worker as a mental health worker in a 5150 unit. So I've seen these officers where they have no patient, no compassionate, no understanding, and handling the individual with a mental illness, So
Thank
No,
you.
you're
There-
100% right.
It's going to expand significantly.
Yeah, and there have been some, different, and that's what Washington State is working on too. And prior to that, we did have a couple where, like we had a policeman with somebody else going together, but I want to recognize Deborah. Oh, you're off mute, like you wanted to share.
I think Deborah just reconnected and maybe was
Oh.
trying to get things set up.
Because she shared about the
You're welcome
escalation.
to share though, Deborah. You're part of here. You're part of this space with us. Connect however you feel.
Yeah, I'm
But
on
thank
two
you for that
devices.
de-escalation.
Sorry, I'm on two devices. You get to see the milk thistle there in Kenneth Hunter.
Accessibility, whatever
Okay.
works.
Yeah, I was I just need to vent. The whole thing about the training was a real turnoff. Most of the people, I don't know anybody from my class, and I'm not going to mention which program. It's not important. But the point is that the graduates were not motivated to go and get jobs. One of the things that we all complained about is it's not sustainable. The issue of all the jobs we're looking for 40-hour a week. And most of us have our own medical issues, support issues. What the hell? I mean, are they for real? And what I'm seeing is most of these agencies kind of are taking advantage of the peer community. People who have the lived experience, who may have a rap sheet or some other issue, and they know that it's hard for them to get jobs elsewhere. Someone who is in rehab, and they'll say, okay, you got to do 40 hours and you got to work the weekend shift, or you want to work the night shift. Well, that's just going to put people in a setback. It doesn't make any sense. So I really applaud. I want to get involved with this whole unionization because that's where the power comes from. The other thing is during my training, the facilitator said couple things that weren't legally correct even. And when I brought it up politely in class, he shot me down in a very aggressive way. The trainer himself was just like, what? Am I going to enter into this world where there's this disrespect? Some other things happened in class. It was really not encouraging to enter into this world. It was like, Deborah, do you want to bother with this? No.
That sounds like it would have been really helpful to have some kind of union support to or have a forum to be able to share about this and whether, what state or whatever.
So there's one guy I created after our class. I said, hey, you guys, do you want to do a WhatsApp chat? Let's make a little, and I didn't even know what all of this extensive peer community that's out there. I had no idea. They didn't educate us about this. I kind of have been finding this out through the back door. I know about Share, so I'm involved with Recovery International. I only found out about it through my fellow in Recovery International. This should have been sent out to us through the agency that trained us. There's one guy who was sort of doing a lot of recruitment. He was a former grad, and he's really pushing for people. And I keep saying the thing over and over again. You're giving us jobs, suggestion of jobs that are 40-hour of the week, et cetera, and he doesn't reply. I think his job is just to try to recruit, but he's not on the same page. He's almost like I don't know how to summarize this, but the idea is that instead of seeing himself as a fellow peer alongside with us, trying to promote sustainable employment, he says, oh, goody, I get this job to do recruitment, and I'm just going to push these jobs on people. Anyway, there has to be continuing education among our rank and file. That's it.
No, you're 100%, Deborah. Thank you so much for sharing. I'm sorry you had that experience with your training. I felt like I had a really great training for Wisconsin, and then my intentional peer support training was pretty good. But because my Wisconsin training was so great, maybe it set a different kind of bar. But it sounds like you just had a wholly different experience. Your experience was more like my intro to the unions. Like, oh, do I want to be here? Is this what a union is? But then I got some other organizations. I met some other people, and I feel like the training really doesn't prepare you for the actual work. For what we do as peers and how we engage with them, that really comes with that experience that you get from providing it or having that co-reflection with other peers. And you don't get enough of that in training. You don't get enough co-reflection.
So Mitchell, I want to be sure that we give Joanne a chance to
Please.
share, and then Richard has something to say, and partly Richard's been also talking about the California peer professional support, which might be a resource. So Joanne?
Yes, good afternoon, everybody. I'm Joanne, and I'm in the LA County area too. And let me tell you something, when peers come together, it's a whole total different environment than actually working out there in the field. I am labeled as a community health worker, and my concern is I'm going to be more of a community health worker, or am I going to be a peer? I just recently passed the certification, and when I looked at the different areas, advocacy was a weakness for me because I'm not able to advocate enough because the medical team feels that peers are not trained enough to de-escalate. And they feel that we don't have enough experience to advocate on the client's behalf. It's always saying that I'm the one speaking up for the client, but the client is actually telling me what he wants. And I go out there and get it, but the medical team shoot them down and want to put them in a facility, and it breaks my heart. So I'm hoping that the job of a community health worker who thinks they know everything about a peer, and a peer is separated because there are two different job descriptions.
100%. We do not want that cohabitation of role. I think what you're speaking about, I think that when you get that dual certification, you could be a peer, wear one hat, and then wear another hat and be a community health worker. But in the same space, you could be providing those services under similar functions. It depends on what's acceptable to you. Like, I'm a culinary artist. I like to cook. I could meet with a peer who has Parkinson's and has trouble with cooking, and we could cook. We can have a great meal. We can have a discussion. That can be all part of my peer support. It doesn't have to be listed as a job function that I have to provide meal cooking for people, but it could be something that I have with Joe or Jan, the person who suffers with Parkinson's disease, is something that I find as part of or something that we find, I should say, as part of their path to recovery, or something that facilitates that need, that mutuality piece.
I understand that, but I'm in the department where when you get ready to put someone on a 5150, I don't feel I need to be bringing somebody to a gurney because I'm non-medical.
Yeah.
I can work with my client to get them to meet the medical team, but I should not be the one to coerce them to the gurney. Maybe a community health worker can do that, but not me. I need to be there to support that client once he get into that facility. And that's another thing we're not doing. We're locking them up, but we're not helping them develop a wellness plan for them to get out.
And I want we've just got a couple minutes left, and I know that I think this is a good topic in the future for people to talk about similar roles like community health workers and also ombudsman. I just recently met one of our ombudsmen where there are a lot of behavioral issues. I mean, there's a lot of resources there, but our ombudsmen are for the people in facilities are not paid. And they're in the volunteers, and so I think there's a lot to be worked on, and that would be partly if it's something that would be good work for the union.
Yeah, like
Richard,
you mentioned, a lot of other employers are, they're defining the roles. They're deciding what a peer is as opposed to abiding by SAMHSA's guidelines, or what the trainings from your states are saying, what your core competencies and roles are. So it's definitely something that we need to keep advocating for, and showing the employers, like you say, joining force to show, like, you can't have peers be doing this role. You can have other people do this role, but you can't require it of your peers. If they want to do it, if it's part of the support plan, then they can. But if they don't want to, they shouldn't have to. Richard, do you have something to add?
I just want to respond to Deborah's issue with the 40-hour work week. You can always request a reasonable accommodation as a part-time job due to your disability. Legal Aid at Work on their website, they have packets about your legal rights and how to go about it, and etc. All the information is in there. They're good tools to use to educate yourself so that you know what you need to do, how to go about it, and contact us at CAP. We'd be more than happy to help you, because I do recognize that is an issue with peers throughout the state about the mandating the 40-hour week when that just doesn't apply. I stopped working a year ago due to COVID. I haven't been the same since COVID. Now I'm only able to work part-time instead of full-time. So
Mhm.
it has impacted me negatively. So I'm aware about my rights, and that's the route that I'm going. And if they don't choose not to comply or follow an interactive process with the applicant or employee, whichever category I'm in, I would go to the Department of California Civil Rights Office. They handle employment related matters and issues.
Thank you for sharing all that, Richard. I know I've got some personal experience in that as well. Deborah, you had your hand up. You want to add something else?
Okay,
Want to make sure we
sorry,
got
I
you
have,
before.
like I said, I have two devices. Okay. That was great, Richard. The only thing I'm concerned about is that's why we need the union, right? Because if, they'll just won't hire you if they find out you're not going to be willing to do what they want. But like I think also, creating a standard, I don't know how to articulate. I know you guys in the union and Mitchell and Laurel probably can put the words together. Kind of standard of expectations, right? A standard of what's reasonable. Someone who's a recent grad should be given like a 24-hour week so we can take care of our other matters. These kind of things is really what's in transportation issues. There's a whole bunch of things that makes it not doable, and they want to throw us into, going in from not working at all to, all of a sudden we should become, like a 40-hour week person without without the accommodation. Anyway, that's it, kind of. I
No,
really love this. How do we, is this going to be like, I know this is part of a grander conference, day-long conference, but I really want to reconnect. This is really awesome what you guys are doing.
if you want to put your email in the chat, I'll send you an email, Deborah. But I just want to touch on like a few things, I guess, with the disabling conditions and things. I mean, with my own employment, I needed that a space where I could work the hours that I needed. I can't necessarily with my condition. Maybe I'm in the hospital for a day or three because I'm, vomiting my guts out or something, and there's nothing else I can do. And an employer normally would be able to accommodate that. But in other spaces, there's an opportunity. And I think by having a cooperative in a space where you're basically your own employer in that sense, where you are the peer in that sense, you decide whom you're going to be providing services to and what type of services you're going to provide, whether it's completely in-person supports, whether it's virtual supports. You've got that choice because all of those opportunities are available to you because we have enough employers or we have enough contracts with our cooperative to make that happen. And that's all just building that partnership and growth. If we have enough, if we need mental health practitioners to supervise us, we have them do that. But then we also provide those peer supervision pieces that are essential in our growth and are essential for actually providing the supports that we need for our employees to do the effective jobs that they do. So it's
Mitchell?
all about providing it all there full circle.
Mitchell, just so you know, we are over time, and I think, Deborah, are you the next presenter in this space, in this place?
Laurel, there's a 15-minute break between each presentation,
Okay.
and that's
And just so
where
you know, there are two things. She's on anyway, but I just wanted to say that where I started working part-time and those positions weren't available, but I really saw there could be a real role for people that were job sharing, or also for us, it was a matter with COVID. Some people couldn't be in the office all the time, and my job was remote originally and then came in. So she wanted to know more about cooperative, and I want to say I appreciate everyone. I have an appointment I need to go to, and we'll be in Peer Apocalypse in about 2 weeks.
Mm-hmm.
Okay. Thank you.
Hi, Laurel.
Bye-bye.
What was that other question there somebody had? A cooperative is like an agency in which, okay. So a cooperative is generally a space in which everybody has a piece of ownership. Think of like employee owned, but in this case, we're all have a vote in what happens. We all have the same vote and a say, so that we all have that equal position. And we're peer ran in the sense that most of our organization will be comprised of peers. But I did want to touch on, we'll also have community healthcare workers, clinicians, all the essential supports. It's our leadership and things that are going to be peer led, because we need to keep those peers in the scope of our practice and everything. If we're not having representation of peers, then we're not really a peer organization. And we need to make sure that we're doing that. Our peers it's about that, having a peer provide all of the supports. And I don't mean take the supports away from the other providers. I just mean keeping that peers are what we are, and that there is no other labor organization like us, and we don't want to be cooptated by other types of organizations. We want to keep that peer fidelity throughout. And we see that on the fee for service model for for Medicaid reimbursement for community CCS, CRS, CBHCs, all these spaces have peers work with all the other modes of all the other modes that are out there with clinicians, with peer run respites, with all these spaces. We want to be able to work with them all as opposed to separate ourselves and say we just need to focus on us, because by doing that, we just support that exclusion, and then we're just the kids over there doing whatever we do, as opposing to showing the value of peer support and how we can support them in their own clinical fashion, and how they should be supported like we do, and by their own peers, but instead of with anyone else. Is there another question in here? I see maybe Mike McKinnon wrote a cooperatives piece. I would like to connect with them. I've been in connection with a few places like the United States Federation of Cooperative Co-op Councils, some other spaces, the Cooperative Development Institute, CDF. All these spaces are places that we're connecting with to develop cooperatives as soon as we have enough providers or other pieces of the puzzle to get things going. So I know Wisconsin, I've got connections with the Rock, Walworth, and Jefferson counties, and some other counties where we're developing that cooperative to be a piece. But there's other spaces where we have peers in like Illinois, New York, and other places where we're trying to get the next steps put together as well. It's all about one step at a time, and then once they fall into place, getting it started, and then making sure that we have all the supports there, and then continuing to build from there. Just build that network out. It was really great meeting you all. I know we're in overtime here. It's just an open space to chat, relax, decompress for our next meeting. Our official presentation's been over. If you need anything else in the chat, just ask. I'll be happy to send it. I think I sent an email to the couple people that asked. I think I got another one to actually hit the send button too. I appreciate your time. Thank you for joining us. Do 17 deers. Okay, there we go. Happy to answer any more questions while we have a few more minutes. I know there's a lot of despairing differences across the nation that we're always facing, but can only be aware of so much, right?
Okay, I've got to get off, but
Thanks for joining us.
when I first got on, I was on my mobile device, which doesn't allow me to save a chat. And I missed a lot of the earlier parts of the conference. I understand this was recorded.
Mhm.
And we'll be able to find, will the transcript of the chats be accessible with all of the info that was shared?
I believe so, but if not, do you want to just verbally give me your email? I can send you an
Yeah, I
email
gave
quick.
it to the DO one. Yeah,
Then I just sent it off, so we should have just been
awesome. So,
connected, and then we can reconnect however you need.
okay, so that's going to be, no, but specifically if you can send me the entire, because I came into this session a little bit late in the game. Yeah, support by peers, about like being able to link issue to issue, so to speak. Like if there was like a forum, let's say, I don't know if you have on the website, post issues and people.
I know it's one of the things we're
Sense.
developing is some additions to the website, like a forum, as well as some spaces to sign up and some things for not to sign up, but some other spaces for members to be able to post things for and to interact and engage, or for other spaces, like I don't want to reveal it quite yet because it's still in development, but some spaces for organizations, individuals, and others seeking cooperative force joining on endeavors that could fund and help the workforce without giving out too much. That's one of the things we're working on right now, is adding that form into there so that or agencies who are members can add that and field into the information and connect with peers, or peers can add that information and get those connection pieces. There are several national organizations that will have that have peer forums for you to connect with other peers and get some other information. I know the National Peer Support Warm Line Council is a great space for warm lines, as well as to provide other supports, Doors of Wellbeing in the Copeland Center. Again, those are links are on our website at peersupport.us, www.peersupport, P-U-R-E, little play on words there, because we purely
Can
support.
you type things in? I
Sure.
have it on the processing, and it doesn't help me to hear things rattle off.
It's in our email too that I just sent you.
Okay, cool. I'm gonna get off because I have another job I
Yeah,
have
you
to
take
deal
care. Have a
with.
great day.
Good for you. You're doing
Thank
great.
you.
And whose flag is that that's folded behind you?
That is my grandfather's.
Okay. Thank you for the service. All right.
Appreciate it. Thank you.